I was honored to be invited to the Exstrophy workshop in India this past January. For those of you who were here last year, I shared a little bit about some of the philanthropic work that is going on there. And so I was invited to go and observe and to just see how ABC can get more involved in funding some of the efforts over there. So I spent 10 days in India with a team of surgeons from here, and then Dr. Sally from Qatar. And we saw, it was 132 patients, and they performed 32 exstrophy surgeries in the 10 days that they were there. And I can't tell you, I learned so much. They also sponsored an international workshop, and we had 150 doctors, 150 plus pediatric surgeons that were sat in an auditorium in Ahmedabad's hospital while the doctors performed 4 live surgeries and then taught and used it as a teaching opportunities with the doctors. So that was a phenomenal event. And while the doctors were busy in surgery, I became the child life expert in a day and put together a mini exstrophy boot camp with the children. As you can see, these are the 100 or so kids that are all in a ward about the size of this room, and they spend a couple weeks there while they are getting their exstrophy treatments and hopefully being one of the ones selected for surgery that year. A lot of times they come in from many days of the train or the bus, and they come in and they, again, get their care. Many of them have been treated over the past 7 years that this program has kind of organically grown in India, and they're back there for their follow-up treatment. And you know, they're in the bed, and there's no child life nurse, and there's no iPads, and there's no treat cart that my daughter knows so well. I taught them Itsy Bitsy Spider and the ABCs, and brought in kites, and hopefully next year with a team of, hopefully a nursing support team and some child life help, we can kind of expand this program and give them more next year. With all of this, we have added another advisory board member, our first international advisory board member other than Dr. Sally. Rakesh Joshi is now part of ABC's medical advisory board, and he really is helping us expand an international collaboration with the bladder exstrophy in India and in Asia. Again, we're really looking as the next point. I think we've got the surgery part down, and there's a lot of collaboration amongst the surgeons there. And now we want to really grow the program and start to sharing best practices with the nursing staff, the pre-op care, and educating and supporting the families on how they can help their children grow and be as productive as they can be. And we have started working on the goal, the strategic plan, and it will happen, I'm hoping within the next 24 months, to build an exstrophy center in India. So I'm actually working through that process and working with some global corporate sponsors to help make that happen. This was the team that was in India last year, and the team rotates every year. And when I look at my medical advisory board, I go, hey, I've got the best of the best, because either they're in this room or they're in India last year, or they're going to be there next year or the year after. So this is, again, if you haven't been out to see, these are the group of experts that I call on every day to help support the ABC community on a global level. So just want to thank Marlo and Dr. Gerhardt, who's here in the room today, for all of the dedicated support that you provide us. And as you had talked about, none of this happens without philanthropy. And these are the corporate sponsors that have stepped forward to help me, again, with seed money to get the organization going and to be able to bring us out to a global. So I wanted to thank all of you. And then the Bergs have also support me as well, and I really appreciate all that you do for me. And a lot of families have asked to to remain anonymous, and so if your name is not on this list, it's because I was, you know, respecting your wishes to remain private. But again, support really are. We are a community, and it is a rare disease, and there's not a lot of us. But we're so small and so rare that really, if we all got together, we could help everyone. I mean, we're not so big that no matter what we do isn't felt. You know, we're small enough to where you're different. It does make a difference, as you said. So I again appreciate all of the help that you've all given me. But there's so much more work to be done. If anybody wants to, not to take away from Hopkins, but if anybody wants to co-sponsor a fundraiser like Lee and Nick did, got lots of ideas. I'm happy to work with you. We're putting together a medical sponsorship for families in India. It takes only $500 a year for them to have their medical care. So again, everybody, this helps, and $500 a year could sponsor a family for a year. Volunteer. I have a list of things that I can help with. So if you want to get involved, please just ask me. There's a lot of work to be done. And donate. We're fully, we are 501(c)(2), and so all of your donations are tax deductible. Together, we all can make the highest standards of treatment, care, and support within the reach of all people affected by bladder exstrophy. So I thank you for your time.